So we have about 46 people now. So I'm going to say let's wait 2 more minutes and then we'll get started. Okay, I think we should get started. Sounds good? Great. Oh, the slides disappeared.
Wait, did you want the slides on?
Yes, please.
We're having everyone turn on their videos.
Oh, yes. Okay. If everyone has a video that's working, if you can please take it on, turn it on, that would be great. We would love to see your faces. Wonderful. Hello, lovely to see you all. It's too bad that we could not meet in person, but this is also good.
This is the next best thing, Connie.
Yes, absolutely. Absolutely. So we're so delighted that you're joining us on this journey. So welcome to the Global Road Safety Leadership course, specifically for initiative partners, or as we would like to call it, GRSLC IP. And before we start today, I'm going to go through a few housekeeping things before I present our first presenter. My name is Connie, and I'm an assistant professor at Johns Hopkins University, and I am delighted to be your moderator for today. And so housekeeping, next slide, Abdul, thank you. So first of all, we warmly welcome you to be engaged throughout this webinar. We would love for you to ask questions, and I'm sure many of you are very familiar with Zoom right now, but just in case. So if you have any questions, please use the chat function below. You'll see it's at the third icon, and we have a picture of it there, so you just click on it. And we ask that if you have any technical related questions, to please chat directly to the course host. If you have any questions for the presenter, please chat directly to myself, the moderator. And then if you have general questions, please feel free to chat to everyone. The reason why we're doing this is so that we can very quickly answer your questions and then tease out the ones that is specifically for presenters. So there are times when we have sufficient time, we may ask one of you to ask your questions by unmuting yourself. And if that's the case, we'll write a message back to you and ask you if you feel okay doing that and if you have a mic that's workable. So watch out for those messages. And we've just asked you to turn on your videos at the beginning so we can see your lovely faces. And we'd love for you, because of the bandwidth, we'd love for you to just turn off your cameras while the presenter's presenting so that there won't be any issues with connections or anything. But at the end, we would love for you to turn your cameras back on so we can, see you and have some active engagement as well. Next slide, please. If you are having any problems with the course platform, please raise a ticket on the platform. And to do that, there's a video on the course website that will show you how to go about doing that. And you can also select the contact tab at the very top right corner of the platform to raise a ticket. And so I think that is all the housekeeping for the day. Welcome to the course, and I'm delighted to introduce our first presenter. This Dr. Abdul Bachani is an associate professor at Johns Hopkins Bloomberg School of Public Health. He is also the director of our International Injury Research Unit. So he will be giving you an overview of the course right now. Abdul, over to you.
Thank you, Connie, and again, welcome to everyone. As Connie said, unfortunately, we can't be together in person, so this is the next best thing that we have, and we're really glad we were able to do this. I'd like to just extend a special vote of thanks to our donor, Bloomberg Philanthropies, and Kelly Larson is here, who is representing Bloomberg Philanthropies, for allowing us to really do this. This is an unprecedented time within the field of road safety. At least over the past 10 years, there's been a lot of global attention to road safety. There's been more investment in the field of road safety, and a lot of it through the Bloomberg Philanthropies, to really make a change. And all those of us who are gathered here are in some way, shape, or form working under the Bloomberg Initiative for Global Road Safety. Bloomberg has put this trust in us, and it is up to all of us to make something of it. And therefore, we hope that through this course, we can all get on the same page as we start this initiative this year and over the next, over the coming 5 years as well, to be able to make a difference in all our cities and our country, so we can work together across different disciplines to bring about lasting change. And so all of you as participants in this course for this offering are related or working directly on the Bloomberg Initiative as part of any one of the partner organizations on this initiative. We do have 87 participants in this course, in this offering right now. This is more than any of our other previous offerings that we've had. We have slightly more women than we do have men participating, which is a good thing. And it's been trending that way since we first started this course in 2016. So welcome to all of you. And we'll just go through a few slides to see what continents are represented. You can see that we have representation from almost everywhere. We have folks from Africa, the Americas, Asia, Europe, and actually I think we could do a poll somewhere around now to see how long all of you have been working on road safety. So one of our team members will put up a poll that you can respond to. And we have 21 countries represented. This gives us a tremendous amount of breadth and diversity of experiences to learn from as we try to implement some of the same solutions, but in different ways that are more contextually specific, and learn from each other in terms of what works best in different countries. So I do urge you to engage both with us and with each other as well as you go through this course. And we can see here, as the results are coming from the poll, that the majority of folks have been working in the field of road safety for about 1 to 3 years. That's great, that's what we see. But we have folks who have been working in this area for between 4 to 7 years, and at least one person who has more than 10 years experience. So we look forward to learning from all of you. But a significant chunk, as we can see, of participants who are represented here have worked in this area for less than 12 months. So it's very important as we go through this course for all of us to be on the same page with respect to the technical issues around road safety, but then more importantly, move towards looking into how best to implement things, programs, customize them for our individual settings. Here we can see the diversity of countries that are represented. As was said, we have more than 20 countries represented, and this just gives you a sense of what the countries are. While we do see a large chunk from the United States, it's not basically folks who are affiliated or live in the United States, but are doing work in many of these countries. So it's not like we're focusing this work in the United States. Just wanted to point that out there. We do have a diversity of backgrounds represented among this group as well. So we do have folks who are associated with academic institutions or focused on research, who are working on either data collection approaches or doing research in different ways to make sure data is being generated and used in an effective way. We do have a lot of folks from government, as you know, through the Bloomberg Initiative for Global Road Safety. We're working directly with city governments to implement programs. We have international organizations represented, NGOs, as well as other organizations represented too. So again, just to say welcome again to all of you. As I said, we have a really diverse group, and we hope to have an engaging 5 weeks or so of discussion, but let it not end there. We have planned for you an interactive course. We will go over the course objectives and different avenues for interaction in a little bit. But before we do that, I would like to invite Kelly Larson from the Bloomberg Philanthropies to give us to say a few words of welcome and to give us an introduction on the Bloomberg Initiative for Global Road Safety.
Thank you, Abdul. Hi, everyone. Great to see you via Zoom. Wish it was in person. My name is Kelly Larson, and I'm coming to you from New York City in my apartment. And really excited to welcome all of you to this 8th offering of the Global Road Safety Leadership Course IP. Connie, I didn't catch what the IP stood for.
It stands for Initiative Partners.
Oh, Initiative Partners, even better. So really great to see all of you, and hope that you and your families have persevered over the last 6 to 7 months in this time of COVID. We know it's a difficult time, and just hope that you all are staying safe. As Abdul mentioned, Bloomberg Philanthropies has been supporting road safety for a number of years, actually since 2007. We've committed $500 million to reduce road traffic fatalities and injuries throughout the world, focusing on low and middle income countries. And I think that this course really is such a great opportunity for the partnership and for the initiative to come together, since all of you are in one way or another a part of the initiative. And so just really excited to have you collectively together through this course to share your lessons learned, to learn from each other, and to really begin to think strategically together on how we can move road safety forward in the cities and countries where we're working. Just very quickly, before I jump into the different phases, really road safety fits all of the criteria for why Bloomberg Philanthropy supports this initiative. We know it's a leading cause of death, the 8th leading cause of death. Road traffic crashes kill 1.35 million people and injure 50 million every single year. And we know it works. We know how to reduce road traffic fatalities and injuries, but it's a matter of working collectively with governments at the subnational level to implement these effective interventions, but also to strengthen those laws and the national legislation that allows for the implementation of road safety. So we're really excited because we know that through the course of our support, we've saved more than 312,000 lives and plan to save twice that number in this next 6-year initiative hard to believe we're already concluded the first year in this time of COVID, but we're very excited about the progress that's been made in 2020. But just for background, as I mentioned, we started road safety in 2007 with a very small pilot in Mexico, Vietnam, and Cambodia. And we really saw some great outcomes of that work, and then expanded our funding support to work in 10 countries from 2010 to 2014. Really, again, to work on that strengthening national legislation and implementing evidence-based interventions, all of which you'll learn about in this course. And I know that you're all probably very familiar with it. In 2015, we expanded the work to work specifically in 10 cities and 5 countries. So at the city level, working on implementation, improving those risk factors that you all are familiar with, redesigning city streets, improving surveillance and data so that we can focus our efforts, and really increasing awareness of road safety through mass media campaigns. In 2020, we doubled our funding commitment, $240 million, but we tripled the amount of work that we need to do, increasing from 10 cities to 30 cities and from 5 countries to 15 countries. So we all have our work cut out for us as we've doubled the funding, but we tripled the work. And we're really excited that all of you are partners in this initiative. I won't go into a lot of detail about the specific interventions because I know that you're all very familiar with it, but this map here on the slide shows those cities that have either signed on or we're pursuing, as well as the 15 countries that we are working in. I see that we had a late country come on board in Ukraine. I don't know if that's on the map, but happy to say we have currently 15 countries that we're focusing in, listed here, as well as 19 cities out of the 30 have already signed on. We're working hard to get Dhaka South, Kuala Lumpur, and Kyiv on board by the end of this year. And then next year, we'll add 8 additional cities from the 15 countries where we're working. And really, I just can't say thank you enough, in particular to our teams on the ground. I think the model of our road safety work has allowed us to move forward pretty significantly this year, even via Zoom. It's because of our strong footprint on the ground through embedded staff, government officials that are part of the initiative. And so just really thank you for being the glue between the partners that are funded through Bloomberg Philanthropies and the government agencies in the 15 countries and the 19 cities, so that we can begin the planning, continue the work, and really look forward to the next 5 years of the initiative. And fingers crossed, we have good news on vaccines, that this time next year, we won't be doing this course by Zoom, but we'll be in person, which we recognize is such an important component of our work, just being able to partner together, share meals together, strategize together. So, while we can't do that this year, inshallah, we'll be able to do it in 2021. So just want to thank all of you for your commitment on road safety. We've got advocates, engineers, media specialists, reporters, government officials, epidemiologists, and all of you have something to share and something to learn. I can say that when I started supporting the road safety work at Bloomberg Philanthropies in 2009, I wish there was a course like this for me, because I was very new to road safety. And I have to say that everyone in the initiative has been so instrumental in helping me in understanding road safety, what's effective, how we can work collectively together. So we're in this together, excited to be a part of this course. I'm not planning to sit in on all of the course, but my colleague, Michael Estrada, who's at Bloomberg Philanthropies, will be participating in the course. So I'm looking forward to hearing more about it from him. And I may pop in to say hello every once in a while, but just really want to wish you all the best. A big thank you to GRSP and Hopkins for pivoting so smoothly from planning an in-person meeting in June to postponing it to December, and then finally coming to November 16th and really kicking off this course via Zoom. So thank you so much. You're in the best of hands with GRSP and Hopkins, as well as the other partners in the initiative, and looking forward to hearing more and wishing you and your families all the best during this difficult time. Thank you very much.
Thank you, Kelly, for that. And just echoing what Kelly said, that we have a lot of different experiences in the room again, and a lot to learn from and with each other. So with that, I'm going to welcome Dr. Judy Fleiter, who is my counterpart at the Global Road Safety Partnership, to walk us through all the partner organizations represented in the Bloomberg Initiative and what their roles are. And this is important for us all to understand as we embark on implementing activities related to this project, in terms of understanding who is who and what everyone does. Judy, over to you.
Thank you very much, Abdul. And Kelly, thanks for your warm welcome, which we share as well. It's great to have you with us today, and great that Michael is participating throughout the whole course. Kelly, feel free to drop in anytime you like over the next 5 Mondays. We're here, so if you want to come join us, come and join the fun of the very first GRSLC IP. It's wonderful. Let me add my welcome on behalf of the GRSP team to this great course that kicks off today. We've already had one webinar. This is webinar version 2 of the first Monday. So we had your colleagues from parts of Africa and Europe joined this exact webinar earlier today, minus Kelly Larson because she was still asleep. But it's nice to have a bigger contingent joining for this second part of the first webinar. And we've got, I think, every partner represented. So we just wanted to take an opportunity. Let's start with a poll, please, pollmeisters, to ask you which organization you're representing of our 10 partners. And I think there's an option for other if you belong to an organization that is aligned with one of the primary partners. So feel free to just tell us which organization you're representing today. And this will probably shift, these numbers will probably shift according to whether it's the Asia timetable webinar or the Americas timetable webinar. But I can see that we've got quite a good distribution across partners. I think a couple of people might still be voting. Okay, are the poll results up? It looks like they are. So yeah, I think we have a representation from every organization. So warm welcome. And it's great to have this mix. As Kelly said, we really are here to learn from each other, to learn from experiences, even if you're brand new to the field of road safety. As we saw in the poll earlier, some people are. That's a wonderful thing because you bring fresh eyes. It's equally as important to have people who've been working in the field for a while and also people who are more experienced. We genuinely are here all to learn from each other, and we will continue to do that for the remaining month and a half of this year and the remaining 5 years of the initiative. Thanks very much, everybody. Could we just go on to the next slide, please? Thank you. So here are all of our organizations, the 10 that we represent. And we just wanted to present them, particularly for people who are brand new to the initiative. I know that some of you have joined in very recent weeks, and this is a big family. And it's quite a complicated family. We're across cities and we're across countries, and some partners are working in some and not others, and some partners do more than one thing. So we just thought we'd take the opportunity to share some information at kind of the top level of what the partners are all doing. So we'll do our best to cover that. So for the national level work, which we know is a huge priority for Bloomberg Philanthropies, to get evidence-based legislation and policies into as many countries as we can. And so there are 4 primary partners working on that. Our colleagues at the Global Health Advocacy Incubator, and I know there's lots of you online this morning, hello. Our team from GRSP, our colleagues from Vital Strategies, also many of you on the line, and also from the World Health Organization. So they're the 4 primary partners in the initiative that are focused on getting solid evidence-based policies in place and then hopefully having them implemented as well. Next slide, please. So the next one we've broken up into global support and city support. So for the global support, together with our colleagues from Johns Hopkins University, as you just heard, GRSP and Hopkins have the pleasure and privilege of developing and delivering the suite of GRSLCs, the Global Road Safety Leadership courses. And shortly, Abdul will take you through a little bit about the courses that have happened before this one. But you're groundbreaking participants today, folks. You're the first cohort to go through this Initiative Partners course, and we're really pleased that you were able to join us and thrilled to have the opportunity to present. And then, of course, our colleagues at Global NCAP, the New Car Assessment Program, and their affiliates. So I think we have some people in this course from Latin NCAP today, working at the global level in terms of supporting vehicle safety and fleet management. City level support, we've got our Hopkins colleagues, our Vital Strategies colleagues. You can see they're doing a range of things to support those of us working at the city level. So thank you for all of that work and support. Next slide, please. I think we're moving on to our infrastructure partners, many of you on the call as well. So colleagues from the World Bank at the Global Road Safety Facility are supporting infrastructure in this initiative. Our colleagues from NACTO also, and our colleagues from the World Resources Institute. So 3 key infrastructure partners working together to ensure that our roads are as safe as they can be and our urban spaces are as safe and equitable for sustainable mobility as we can possibly achieve in the next 5 and a bit years. And then the next step is road policing capacity building. There are 2 organisations working on that across the various cities. So that our team from GRSP, and also hello to our colleagues from the IACP, the International Association of Chiefs of Police, who are on board with us, I think, today as well. We're working in different areas apart from India. We're both working in the country of India to support road policing. Next slide, please. I'm going to hand back over to Abdul. So finishing with a warm welcome again and back to you. Thanks, Abdul.
Thank you, Judy, for that. And so we will now move on to really the meat of this webinar. And this is the first in a series of webinars that we will have for this course to provide an opportunity for live interaction and discussion, in addition to all the course content that you will have available to you on the online platform. So really the purpose of this webinar today is to bring everyone together, to meet each other, and to introduce this course, highlight what the objectives of this course are, what our expectations are, what you can expect from us, and what we would expect from you in return. As Judy mentioned, that the Global Road Safety Leadership course is the larger umbrella under which this course is being organized and implemented. And really the main objectives for that course are to enhance leadership to support strengthening of road safety policy and program implementation in cities and countries. And we do that through bringing everyone on the same page in terms of principles and best practices and how to apply those principles and best practices in road safety to address country-specific issues and challenges. We have a strong focus on interventions and policy development. So when you are working within programs in your own cities and countries, that you have the skills necessary to design and implement interventions and policies that are following best practices. To build skills in policy advocacy, as we recognize this is a really important aspect of initiating and impacting or implementing change. So work on policy advocacy, strategic communication, and media advocacy, as well as to enhance capacity to assess and understand critical evidence for effective road traffic injury prevention and control. And through this, we focus on really how to understand what evidence is out there, how to generate data, but more importantly, to then use that data to impact change on the ground. And then extremely important is to build capacity to monitor, evaluate, and report road safety performance processes. Because as you are implementing your programs, as you're implementing activities, it's important for you to keep monitoring how you're doing and adjust course as and when necessary. Because we're not working in static situations. We're working in ever-evolving environments. Things evolve, the economy evolves, the road safety conditions and situations evolve, infrastructure-related issues change. And so it's very important for us to constantly monitor what we're doing, how we're doing it, how much impact we're having, and to adjust our approach as and when necessary so that we're having maximal impact. We started the Global Road Safety Leadership course in 2016, and so far we have implemented 8 versions of 8 iterations of this course. The model that we use for the larger in-person leadership course is each year we do 2 courses. We do one in Baltimore and one regionally. We call it the Regional Global Road Safety Leadership course. And we rotate it to focus on a different region each year. So we had one in Asia, we had one in Africa, and one in Latin America. We were going to have one in Asia this year, but as we all know and understand, this wasn't possible. So we hopefully next year we will resume our in-person leadership courses as things get better. So far, we have trained over 430 people, 439 individuals from 63 countries as part of these leadership courses. Now, given that we cannot meet in person, extremely important for us in designing this course was to make sure that we do provide the similar opportunities for engagement with not only us that you're seeing here today, but with other partner organization staff who have been instrumental in helping us put together the content for this course. And so here you see a timeline and structure, a general structure for this course. We're in the kind of course phase where we're doing the welcome today. This is our first week. You've had access to module 1, which provides you with an overview of the course, what to expect from the course, instructional videos on navigating the course platform. And this today is the webinar that's related to it. At some point today, a little later on, we will open up module 2 for the course, which is an introduction to the road safety problem. It is designed to bring us all on the same page with respect to where we're coming from in terms of addressing road safety. What's the history behind what has happened? Where do we see us going in the future as a field? And we will have our second webinar on November 23rd, which will focus on, in which we will have a discussion on all the content that was covered in module 2. And similarly thereafter, module 3 will open up on that day, on November 23rd. You'll have a week to go through the content, and we'll have, again, a webinar focusing on a discussion around all the content that was covered, an opportunity for you to ask questions, clarifying issues, etc. And we will go on in that way. Module 4 will open up on the day of that webinar. You'll have another week to do that content. It will focus on evidence-based approaches to road safety, followed by a webinar, and then we will have safe systems recap and closure webinar on December 14th. So we look forward to engaging with you through these 5 weeks or so. Again, just to summarize, when these modules will open up, we wanted to make sure that we're providing you with an opportunity to move sequentially through the course materials as each module builds on the previous one. And that's why we're opening them on these dates as specified. The first module, as I said, is open already. You all should have had access to it and should have been able to go through it. The second module, which is focused on the road safety problem, will open on Monday, on November 16th, which is today, a little later on today at 12 noon Eastern time. Module 3 is focused on risk factors of road traffic crashes, injuries, and deaths. In this module, you will be provided with an overview of what risk factors are and then walk through specific risk factors, why we focus on those risk factors for road safety, what the evidence is behind them, and how we can best then impact change when it comes to those risk factors. That module will open on Monday, November 23rd. The fourth module then is focused on evidence-based approaches to road safety. Given that now you would have had an understanding of what the broader issue is, what the specific risk factors are, what things need to be taken into consideration for risk factors, we will move on to looking into what the best practices are for road safety interventions, and that will open on Monday, November 30th. And as I'm going through these slides, if you have any questions, please do use the chat function, as Connie indicated earlier, to post any questions you may have, and we'll be happy to answer them as we go along. And then, as you know, as I showed you through the timeline that we have these different webinars, this provides just a summary. Judy mentioned that we have, for each webinar, we have 2 sessions. We have 1 session that is timed so that our colleagues from Asia, Europe, and some of Africa can participate. That's in a better time of the day, at a better time of the day for them. And then 1 at this time of the day for folks, again, some in Africa and others on this side of the pond in the Americas can participate. So we do ask that before you attend these webinars that you go through all the course content so that we can have more of a fruitful and engaging discussion, that you can gain the most out of this course. So again, just summarizing what these webinars are. For example, before attending the webinar on the 30th of November, we would really ask you to complete module 3, have done the pre-test, participated in the discussion around module 3 and completed the post-test. We will have, as I said, representatives from different partner organizations who have been instrumental in helping us put together content for this course, be available at those webinars. And we would really like for these webinars to be less of lecture style and more of a discussion. So it would be really great if you can come prepared or submit questions ahead of time on the discussion forum, so we can make sure that everyone is getting the most out of this course.
Abdul, I'm going to interrupt you here and ask you a question. So we received a question asking if participants need to join both webinars, or if they can choose which webinar. Can you say a little bit more about that?
Yeah, so thanks, Connie, for that question. And as I said, these, and Judy mentioned this already, these webinars will be hopefully identical in terms of the content that they cover. As you can see here, in some cases, we have the same facilitators for each of the webinars. And so you need to pick which one works best for your time zone and participate in that. I would say it would be preferable if if you're in Asia, then the Asia webinar might make most sense for you, and you don't then have to participate in the second one that's at this time of the day. We just did this to make sure that we're providing an opportunity that's for different time zones to participate, so that there'll be no difference in terms of the content. So let's move on. I have mentioned the discussion forum. This is an immensely useful tool, and I would say actually a very important tool for us all to engage with each other. You should have already had prompts as part of module 1 to answer a few questions on the discussion forum. And this was one, to give you practice in operating the course discussion board, but also to learn who's there, who the participants are, and start engaging with each other. So you should have already entered details about yourself and responded to 2 other participants as part of those prompts. But please do use this discussion board. If you have interesting items to post there related to the content in each module, do post them there. If you have a question for any of our course presenters or any of our organizing team, just do post questions there. We will pick a lot of these questions up in these webinars, and also we'll use the discussion forum to engage with you between these webinars. So we might answer questions there and then pick up interesting discussions on these webinars as well. I'll pause here for a bit and see if anyone has any questions thus far.
So we have a question from Bonnie. Bonnie's asking, can I keep switching which webinar times I attend for any given week? Like, for example, for this week, I attend this one, and the following week, the Asian one.
I would say try to stick with one that you attend, but if you feel you want to attend the other one, really there's no harm in doing so. You will have, in terms of interacting with participants from all regions, you have the discussion board and tools within the online platform to interact with each other. We're kind of trying to have an even spread, although we realize there's a lot more participants for whom this time zone is a better fit. So we'll see more here. But really, there's no limit. I think you should do what makes most sense for you time-wise to participate in. The content, as I said, will be very similar, or if not the same, for both. Okay. We mentioned pre and post tests. We have this course is certified through the Johns Hopkins School of Public Health, and as part of the process, we need to evaluate you in terms of knowledge gained, etc. And so we have incorporated pre and post tests into all modules except module 1. These are really used to determine knowledge levels before you have access to specific course content, and after, to hopefully see that there has been knowledge gained. But we want to stress that there's no minimum grade per se that's required for the pre and post test to move on to the next module. These are used just as gatekeeping mechanisms and to check a certain box to make sure that you're going through all the content. The grades for this course will not be recorded, and that's why we are not allowing repeat tests for the course, to be able to just make sure. I just wanted to make sure that's out there. So before doing these tests, please make sure you have enough time to complete them. These are very short, brief evaluations. They're not meant to trip you up. They're pretty straightforward. So don't get worried about that. If you have any issues, any questions around the pre and post tests, do reach out to us and we'll be happy to answer those. So what are our expectations from all of you? The first thing that we want to stress, and I think that has been mentioned in different ways by all of us who've spoken so far today, by Connie, Kelly, Judy, is that we're all students. We're all here to learn in some way, shape, or form. We have a diversity of experiences and backgrounds represented in this course. And so let's take this opportunity to learn from each other, as well as all the instructors that will be present and have contributed to this course. But as instructors, we also want to learn from you. As we said, we're working in the diversity of backgrounds and in multiple different countries and many different contexts. We know what works. The question is, how do we implement these solutions in the different contexts that we're working in? So we really would like to learn from you as well in terms of what works and what doesn't work, what experiences you bring. And as part of this process of taking this course, as I said, this course has been certified by the Johns Hopkins Bloomberg School of Public Health. So you will be required to abide by the academic ethics codes, a code of the Johns Hopkins Bloomberg School of Public Health, which is available on the online platform. And I would urge you all to just take a look at it before you proceed. So I urge you all to just immerse yourself in the course, do fully participate in the modules on the discussion board, in the webinars. Be curious and really don't hesitate to communicate with each other and with instructors. Do question things. It doesn't mean that if we're saying this is best practice, you just have to take it as gospel. Do question us if you have any other thoughts. It's important for us to have a lively discussion and be open to new ideas. We do ask that you attend each and every webinar and complete all modules. This is a requirement that we have, and at the end of the course, this is how we'll be able to issue you a certificate for participating in this course. Any questions? Okay, so this brings us towards the tail end of our session today. And as I said, there has been a large team that has been working on this course. So I'd just like to take a brief moment and introduce the different course instructors and the teaching team. Oops, I just went backwards. As Judy said, this course is jointly put together by the Johns Hopkins International Injury Research Unit and the Global Road Safety Partnership. You've been hearing from me. I've been introduced. I won't go ahead and introduce myself again. You heard from Judy. Judy leads the road safety team, the Bloomberg Initiative Road Safety Team at the Global Road Safety Partnership. We do have other instructors as well. You heard from Dr. Connie Ho, who's an assistant professor, whose interests lie on the intersection of health policy and injury prevention and has been working a lot in this area. Blaze is another key member of our team who unfortunately, because of time zone issues, cannot be here. He was on the Asia webinar, so he'll be mostly participating on that webinar. And he's a consultant at the Global Road Safety Partnership and previously served as the Asia Pacific Program Manager for GRSP. All of us have been involved right from the very beginning on the Global Road Safety Leadership course. You will hear on one of the webinars and you will see content on risk factors, for example, that has been prepared by Dr. Margie Peden. Margie heads the Global Injury Program at the George Institute. She's an affiliated faculty for the International Injury Research Unit. And prior to all this, she headed the Unintentional Injury Prevention Division at the World Health Organization. On the vehicle safety side, you will hear from Jess Strong. She is currently the Vice President for Programs and the Asia Pacific region at the Global New Cars Assessment Program. And her expertise lies really on vehicle safety and how to enhance vehicle safety for the vehicle markets in many of the regions that we're working in. Sky Duncan is the director for the Global Designing Cities Initiative at the National Association of City Transportation Officials. NACTO is one of the partners working on the infrastructure side of things. So you will hear from Sky as well as Claudia, who is the, I don't know what happened. Who is the Director of Health and Road Safety at the WRI. And she, again, along with Sky, do work on the infrastructure side of things. So we'll hear from them on those issues. Alina and Soames are from the Global Road Safety Facility at the World Bank. Soms comes with tremendous amount of experience from Australia, leading road safety efforts, and currently heads the Global Road Safety Facility at the World Bank. He will be leading the webinar on, I believe it's the fourth webinar, where we will focus on speed as one of the main issues for road safety and how to address speed. So I would really encourage you to engage in discussions with him and learn from all the experience that he has had in terms of impacting change on the ground. We have a host of other people who've contributed. Again, introductions for all these individuals are on the course platform. So I would encourage you to click through their intros to learn more about them. And if you need to engage with them, do reach out to them as well. There's links to their bios, and their contact information is there too. But most importantly, this course really wouldn't be possible without the team that you're seeing here on this slide today. And I believe most of this team are online right now, and I'd like to invite them to introduce themselves if they are. This is the team that has been working on, that you've interacted with, that's been working on putting together this platform and all the materials that you'll be seeing. So Shireen, are you online? Do you want to take a minute to introduce yourself?
Hi, I'm Shireen Vidvania, and I'm a research associate at the Johns Hopkins International Injury Research Unit. For GRSLC, I work mostly on the content and curriculum development and course evaluations. Welcome to the course, and I look forward to interacting with you all.
Thank you, Shireen. Sarah?
Hi, my name is Sarah Champagne. I'm currently named GRSL course, but you understand. I work as a research associate with the International Injury Research Unit, and within GRSLC, I work with a lot of the logistics and a bit of the content development. Thanks.
Thank you, Sarah. Eric?
Hi, everyone. Good morning, good day. My name is Eric Schulman. I'm a communications associate with the Johns Hopkins International Injury Research Unit. And with the course, I'm pleased to help everyone, especially to get all set up on the platform. If anyone has any questions about registration, account activation, any technical issues, please feel free to shoot me an email. And then I'm also helping out with social media and a few other digital media efforts. So it's great to meet everyone virtually.
Thanks, Eric. Abigail? Is Abby still online?
She's here.
Oh, and I'm talking with while muted. Sorry. I'm Abigail. I am the research program coordinator at the Johns Hopkins International Injury Research Unit. This is actually my first time with GRSLC, so I was very excited to help put this course together. And I kind of serve as just a general support for everybody on the team. So if you need help, let me know and I will be here.
Thank you, Abby. And Carmen can't be here for time zone issues. She's based in Malaysia, and she's
here.
Is she?
Carmen stayed up late just to meet.
Wow. Carmen, over to you.
Hi, everyone. Thanks, Abdul. Hi, everyone. Good morning, good afternoon, good evening. I'm Carmen Koo from the Global Road Safety Partnership based in Kuala Lumpur, as Abdul just mentioned. I'm a program and administrative officer for the GRSP. And for this course, like Sarah, I help with logistics and admin stuff. So here to help, just shoot us an email and we'll try our best to help you. Have a wonderful course.
Thank you. Thank you, guys. Thank you for helping us put this course together and all the work that has gone into it behind the scenes as well to make sure that we are able to deliver one this year in a record time frame. And with that, I really would like to just end by welcoming all of you again. I'm looking forward to engaging with everyone and looking forward to seeing how best we can impact change in the cities and countries as part of the Bloomberg Initiative on Global Road Safety. As I said at the very beginning, Bloomberg has selected all of us to help impact road safety, and it's up to us to prove what we can do to make sure that we're using this investment wisely. And so let's learn from each other and apply those learnings on the ground. So thanks again, and looking forward to interacting with you all through these 5 weeks and in the coming 5 years as well. Connie, over to you.
Thank you, Abdul. Just going to talk about a few next steps. Next slide, please. So as mentioned already, Module 2 will be opening up later today. And we hope that you'll get a chance to go through it, ideally before the next webinar, because we will be, so all the webinars, as Abdul said, will be an opportunity for you to discuss the content of the module that you just went through. And so it'd be great that you'd be prepared for it and we can have an engaging conversation on that. And so before the next webinar, complete Module 2, the pre-test and post-test. The Asian webinar next Monday will be led by Dr. Judy Fleiter, and then this webinar at the same time will be led by Dr. Abdul Bachani. And as mentioned, you only need to pick one of the webinars since the content will be similar, if not identical. And you can choose which one that you attend. So next slide, please. For each of the subsequent webinar, it would be great if you can block about 2 hours. Sometimes it will probably be less than 2 hours, but there are going to be times that it will take the full 2 hours. So just to be safe, we recommend that you block 2 hours on your calendar. Next slide, please. We would love for you to engage with us on social media. We have a hashtag for Twitter, GRSLCIP 2020. Please also take a look at our GRSLC course Twitter page at Global RSLC, as well as GRSV's page, which is at Global, at GRSV Partnership, GRS Partnership, and Hopkins Injuries. Next page. Yeah. And if you have any questions, please always feel free to email our course Gmail, grslccourse@gmail.com. And thank you very much. If you have any questions for us, please do feel free to put it in the chat box right now. And I just want to say a warm, welcome to the course. So happy you're here and looking forward to interacting with you all in the next few weeks.
Connie, I just saw a question.
Yes, so we have a question. How many hours would it take to go through the Module 2? Well, I think it will depend on, I think it depends on you, right? Like some people, it might take a little bit longer. Some people might take slower.
But just like to add that as you access the modules, each section has an estimated timing associated with that. So it will tell you approximately how much time you'll spend on each section.
But I think we've planned for Module 2 to take somewhere between 4 and 5 hours maximum, watching all the videos, reading all the content, all the mandatory content. There'll be some content that we suggest is additional if you want to follow up on a particular topic, so that you don't have to read all of the optional content if you don't want to, but the mandatory content, and it'll be clear to you what that is. So you don't have to do it all in one sitting either, right, Connie?
Yep, that's right.
So you can come and go for the next week during the course of Module 2. But if you, in total, I think if you plan for 4 hours over the course of the next week, that should be plenty of time.
Hey, Connie, can we try to get a group photo?
Ooh, yes, great.
Have everyone come on camera and then we can just do a screenshot.
Sounds great.
That's one of the highlights of the group photos when the team comes to New York.
Yeah, that's right. That's right. We do have 3 pages though. So let me see if we can get everyone on one page.
Yeah, it might be tough.
Yeah. Otherwise, we can just take us 3 screenshots if we could put it together. Okay. Still waiting for a few more people. Let's see. Okay, so not everyone's camera is working.
No
It's okay,
problem.
no worries.
No
Okay,
worries, yeah.
a lot of people. All right, so I'm gonna do page 1 first. Page 1, say cheese. Hold on one second. Control Shift. Okay, cheese. Okay, all right, page 2. Let's see, hold on one second. Page 2, say cheese. Hello. And then last, hold on one second. Oh. Page 3. Ooh, what happened? Is this page 3? Hold on, let me just do it one more time just in case. Page 3, say cheese. Actually, I'm gonna do one more for page 1 just in case. Sorry, guys. Okay. 1, 2, 1, 2, 3. Thank you. Everyone looks great.
Great
Wonderful
group.
to see you all. Great. And if there's no other questions, then we will see you next Monday. And good luck with Module 2. Thank you, everyone. Take care.
Thank you.
Thank you.
See you in a
Everyone.
week.
Thank you,
Bye.
everyone.
Bye.
Bye.
Everybody.
Take care.
Bye.